My name is Ashley Wick and I'm doing my daily patient reassessment video. So before I enter the room, I'm going to check the patient's EHR for any new or existing orders or any new lab values that I should be made aware of or any allergies. And then on the outside of the door, I'm going to check for flags or markers which could indicate allergies or a fall risk. And then I'm also going to grab any equipment that I need and then put on PPE as necessary. Okay, knock knock. Hi. Hello. You'll provide my patient with privacy. My name's Ashley. I'm going to be your nurse today. Can I grab your name and date of birth?
Rachel Gench, 12345.
Perfect. Okay. So that matched up with her wristband as well as her EHR. So Rachel, what brings you in today?
I kind of have like a headache.
Yeah. What were you doing when that pain first started?
I was playing soccer.
Yeah. And how long ago did that pain kind of first start again?
Like 2 days ago, I think.
Yeah. And is it like pretty consistent pain or does it kind of come and go?
It kind of like comes and goes.
Okay. And can you like describe that pain for me? Is it sharp, dull?
It's more sharp and it feels like tight pain.
Okay. And where's that pain located?
Kind of like on my temples right here.
Okay. And what makes that pain feel better?
Just like resting and like putting like an ice pack on my head.
Yeah. And what makes it worse?
Just like being out and about and like activity and stuff.
Yeah. And can you rate that pain on this scale from 0 to 10?
Probably like a 5, I would say.
Perfect. Okay, well, we're gonna try and get that pain down for you.
Okay.
So now I'm gonna take some of your vitals.
Okay.
First, I'm gonna use this temporal artery thermometer to get your temp. Perfect. 98.9. That's the normal limits. Now I'm gonna take your oxygen saturation. Perfect. And then you can just rest your hand right there. Awesome. O2 sats 99 and your heart rate is 53. Both within normal limits. So now I'm going to take your BP. So I'm going to measure this cuff around your arm. Awesome. That's the appropriate size. Sometimes if you have too big or small of a cuff, it can cause you to have false readings. So good to know that. Okay. Just going to place this on your arm. Okay, did that feel comfortable?
Yeah.
Okay, so the first thing we're gonna do is estimate her systolic blood pressure. So I'm just gonna locate her brachial artery. Okay, and then I'm gonna pump this up until I can't feel that pulse anymore. Okay, I'm gonna estimate her systolic to be around 120. Okay, and then I'm gonna pump the cuff up 30 more than 120 for her blood pressure. Okay, your blood pressure is 122/70, so that's within normal limits. Okay, and then lastly, I'm just gonna listen to your apical pulse. Okay, is it okay if I lower this a little? Perfect. I'm gonna listen for about 1 minute, so just take normal breaths for me. Perfect. Okay. Your optical pulse is 64, even and regular, and then I counted your respirations to be 17, even and unlabored. Okay, so all your vitals look good. We're gonna move on to the neuro exam.
Okay.
So, my patient appears alert, oriented, and conscious. Body position's relaxed, facial expression is relaxed as well. I'm going to test my patient's orientation. So, Rachel, can you tell me where we are?
The hospital.
Perfect. Do you know who I am?
Ashley.
Yeah, and do you know the date today?
April 17th.
Perfect. Okay, so my patient is oriented to person, place, and time. But if she wasn't, I would use the Glasgow Coma scale just to measure her orientation. And my patient would score a 15 on that. So that kind of just tells me that she is alert and oriented. Perfect. So now I'm going to measure your pupils. Okay. Perfect. Measuring about a 3 or 4 millimeters, which is in normal range. Now I'm going to test your reactivity to light. So just look straight ahead for me. Okay. My patient's pupils are round and equally reactive to light. So, Rachel, can you smile for me? Perfect. So, I don't see or notice any facial drooping or eye drooping or ptosis. So, that's perfect. And my patient's skin appears like even, smooth, color is consistent with genetic background. So now I'm going to test your muscle strength.
Okay.
So, can you squeeze my fingers? Awesome. And can you push against my hands? Good. And then pull towards yourself. Good. Do the same with her feet. Okay. Push towards me. Pull towards yourself. Good. And then are you able to wiggle your hands for me? Awesome. And then wiggle your toes for me. Good. Okay. So my patient's muscle strength is a 5. And so that is good. Full muscle strength. And can you lift your right leg for me? Awesome. And then lift your left leg up off the table. Perfect. And have you experienced any numbness or tingling?
No.
Okay, great. So the neuro exam complete. Everything looks good. So now I'm going to move on to respiratory. So if my patient had a nasal cannula or an oxygen mask, I would make sure to check the oxygen flow rate as well as the fitting of those, and just to check for any redness or irritation around that area. So do you have a cough?
No.
Okay, if my patient did have a cough, I would just make sure to ask her about the quality and characteristics of that cough, and then if there's mucus, just to ask about the color, consistency, and then amount that she'd be coughing up as well. So Rachel, can you sit up for me? I'm gonna listen to your lung sounds. Yeah.
I like to turn. Okay.
Awesome, perfect. Okay, and you can just relax, take deep breaths for me. Awesome. Those all sound clear, but I am just going to listen on your back as well. Just keep taking those deep breaths for me. Awesome. So your lungs sound clear, and I don't hear any adventitious sounds like crackles or wheezing. Perfect. And then
lay back down.
Oh yes, please do. Perfect. And then do you use an incentive spirometer?
I do not.
Okay. If the physician had ordered my patient to be using an incentive spirometer, I would teach her how to use it and just let her know that it's going to help her take deep breaths and to clear out those lungs. Perfect. So everything there looks good. Also with the incentive spirometer, I would just have her breathe into that 10 times every hour. But everything else looks pretty good in respiratory, so I'm going to move on to the cardiovascular section. So I am going to start off by listening to your heart. Do you mind if I just pull that down? Perfect. I'm going to listen to the aortic, pulmonic, Erb's point, tricuspid, and then mitral. First, I'm going to listen with the diaphragm. Aortic. Pulmonic. Erb's point. Tricuspid. And mitral. So everything does sound clear. I'm not hearing any extra sounds, but I am going to use the bell just to get a better listen. Okay. Aortic. Pulmonic. Erb's point. Tricuspid. And mitral. Okay, so your heart sounds are all pretty normal. I don't hear any extra sounds or any murmurs or anything, so that all sounds pretty good. So the next thing I'm going to do is check your capillary refill. So I'm just going to grab your fingers. Awesome. Less than 3 seconds, which is perfect. Then less than 3 seconds, so awesome. While I'm down here, I'm going to check for any edema. So I'm just going to check in the feet. Just kind of feel around. Checking her ankles. And then checking her legs as well. And I don't know any swelling, pitting, or edema, which everything looks good. So now I'm going to feel for her pulses. So I'm going to start off with dorsalis pedis pulse. Okay, those are equal bilaterally, so I'm going to give those a 2+. Posterior tibialis pulse. Okay, equal bilaterally. Gonna give those a 2+ as well. Okay, then I'm gonna check for her radial pulses. Awesome. Those are equal bilaterally as well, so I'm gonna give those a 2+ as well. So if my patient had an IV, I would just check for any redness around that IV site. I would also check the fluid type, make sure that it matches up with her EHR, and then the fluid rate as well. And then I would also see, do you have any, do you wear any, like TED hose or SCDs?
No.
Okay, those, if the physician ordered those to prevent deep vein thrombosis, I would just teach my patient how to use them and just make sure that those were made available to her as well. And just let her know that those promote blood flow and circulation in the legs. So everything looks good in the cardiovascular, so I think I'm going to move on to skin. And I've been looking at her skin throughout this assessment. Do you mind if I just pull this
Yeah, go ahead.
So I've noted no obvious lesions or dressings, IVs, and then her skin is consistent with her genetic background, smooth. I'm gonna feel temperature. Perfect. Temp feels warm. Perfect. And then, do you use a special type of bed, like an airflow bed or anything like that?
No.
Okay. And then I would just, if my patient did have one of those, I would just make sure that it works properly, that she knows how to use it. And then I would also implement a turning schedule for my patient if she was at risk for any pressure sores or skin breakdown, which I would also use the Braden scale to assess for that, which kind of just assesses for like moisture, nutrition, yeah. So yeah, just kind of, it's a standardized scale. It just assesses for my patient's risk of skin breakdown. Perfect. Yeah, and then I would also implement a rotating schedule to rotate my patient. Perfect. So everything in skin looks great. So I'm gonna move on to abdomen. Okay, do you mind if I pull these down a little? I'm just gonna listen to your bowel sounds. So just right off the bat, her abdomen appears flat. I don't notice any distension or anything that I should be concerned about. So I'm gonna listen to her bowel sounds, starting in the right lower quadrant. Okay, so I hear that her bowel sounds are present in all 4 quadrants. And then also I noted that she doesn't have any like dressings, tubes, or ostomies, but if she did, I would just care for those as needed. Okay, so now I am going to just lightly palpate your abdomen. Just let me know if you feel any pain, tenderness, or discomfort. Just let me know. Okay, everything feels normal. I don't notice any protrusions or distension, no firmness. Did you feel any pain or discomfort?
No, no pain
Awesome.
with that.
Perfect. So no tenderness noted as well. Are you having nausea at all?
No.
Okay, perfect. And then do you have frequent stools?
Yeah.
Yeah, when would you say that your last stool was?
Yesterday.
Perfect. And can you just rate that on this Bristol stool scale?
I would say a type 4.
Awesome, and that's pretty much what we look for, so that's awesome. And then do you have any trouble passing bowel movements?
No.
Awesome. Okay, so I'm gonna move on. Or do you void frequently, urinate frequently?
Yes.
Awesome. And then about how much would you say that you urinate?
Maybe like 1 to 2 cups.
Yeah, I know it's hard to tell. Do you notice like a foul odor or anything with that?
No.
Okay. And then any burning sensation
No.
when you urinate? Okay. And then what's the regular color of your urine, would you say?
I would say like clear to like light yellow.
Yeah, and then do you notice if it's like clear or cloudy?
More clear. It's not
Okay.
really cloudy.
Perfect. So that's just gonna help me rule out an infection in the urinary tract or just rule out any UTIs. And then if my patient had a catheter, I would just make sure to check the patency and then check the area around that catheter, just make sure that there's no redness or irritation. Perfect. And then if my patient was experiencing urinary retention, I would just use a bladder scan on her. Perfect. And then, so do you use any aids, mobility aids, or do you need anyone to help you move around?
No, I'm pretty mobile.
Okay, perfect. If my patient did need any aids, mobility aids, I would just make sure that those were available to her and then teach her how to use them if she was unsure as well. Perfect. And then I would also use a Morse scale to assess my patient's risk for a fall. So that would just assess her level of consciousness, any previous falls. So my patient is not a fall risk, so that is good to know. Perfect. And then do you take any medications?
No.
Okay, perfect. And that would also, sometimes some medications can alter a person's level of consciousness, such as opioids. And so since she doesn't take any medications, I don't have to worry about that either. Perfect. So I think that pretty much wraps up our assessment.
Okay.
Can I take you to the bathroom at all?
No, I don't have to go right now.
Perfect. Grab you anything to eat?
No, I'm okay.
Is your bed position okay?
Yeah, I'm pretty comfortable.
Okay, perfect. So before I leave, I would just make sure that the bed is locked, and that it was in its lowest position, that her call light was available to her, and then if my patient needed a bed alarm set, I would just make sure that that was reset after coming into the room. And then how is your pain level, would you say?
I don't have any pain right now.
Okay, awesome. So I think that pretty much wraps it up. Is there anything else I can grab you?
No, I think I'm fine.
Perfect. And then we'll just check on you in a little bit, but I think I'm done here. So thank you for cooperating.
Thank you.